Hello everyone, welcome to the Heroes Initiative powered by IPCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by IPCA. So doctor, now we are focusing on cataract surgery pre and post-operative care. So doctor, my first question for you is, what should I expect during the pre-operative assessment for cataract surgery? Are there any specific preparation do I need to make, doctor?
See, first of all, any person who is having cataract has to understand that they're having some difficulty in vision. They are probably not able to do their household work. So when they come up to us, any person who says, I am not able to see properly, the first thing that we do is a pre-op assessment. A pre-op assessment means that you have to see the anterior part of the eye. You have to see what is the status of the lenticular changes inside the eye. And third, you have to see the retina. See, vision is formed from the front to the middle to the back. So everything has to be in accordance. Now, anybody who comes to us, we have to assess them. We have to check the IOL power that has to be put inside the eye, and then people have choices now. They want different types of correction. Some want, I only want distance correction. I'm okay with near. Some say, I don't want to wear any glasses. So you have to plan your detailed examination so that you don't miss anything.
What are the most important post-operative care steps to ensure a smooth recovery after cataract surgery, doctor?
I think one of the most important things that people need to know, anybody who has gone through a cataract surgery, your eye is going to be bandaged for a couple of hours. The moment you remove it, you'll be given a prescription of eye drops that have to be used as advised by the treating physician or doctor. Secondly, a couple of things that you're not supposed to do: a head wash for a couple of days, for 7 days. Not supposed to splash any water inside the eye. You have to make sure that you're cleaning your face. You just sponge it. Make sure now people have a habit of rubbing their face and cleaning it. That's not gonna happen. And secondly, we tell them to avoid any direct contact with any dust or dirty material. So use of dark glasses when they're going outside, because we do use mydriatics and cycloplegics to keep the pupil dilated. So they should not have any inconvenience while going outside.
Agreed, doctor, what you said. Are there any common complications after cataract surgery and how they can be managed or prevented?
See, it goes out by saying, when you go into a theater, 99% everybody wants to be okay. 1% of chance, there's always a risk of infection. There's always a risk of, intraoperatively, you might find that, the capsular bag in which the lens has to be put, it may not be adequate, or, they may have a capsular tear. So that depends on surgeon to surgeon how they want to proceed it. The most dreadful complication is definitely infection. And I think one of the most important factors for infection is not only a preoperative assessment to make sure that we don't miss anything, like we have not looked upon as something that might be a trigger factor later on. And secondly, post-operative care, in which the patient has to make sure that they don't by mistakenly also spill some water, or spill some dirty thing, or touch their eyes, because everything in your hands is a source of bacteria. So you just have to be careful on that front.
So doctor, your expertise and insights on cataract surgery pre and post-operative care are invaluable to this initiative, and we believe your participation will greatly benefit the patients.